artery, this artery which carries oxygenated blood, middle cerebral artery, it arises from this big giant artery. Can you see this? Is called as carotid artery. Can you see this dot?
Yeah. Right.
It is an end-on cut. Like this is my blood vessel. You can see from this side, and it becomes a proper blood vessel. But if you see from this aspect, you'll be able to see only a dot. Yeah.
Dot. Mm-hmm.
Yeah. So that blood vessel is coming towards you from neck. It is coming towards you, and through the slice, you are able to see only a dot. So this is the tumor. This circumscribed hemicircle. This is the tumor, and the blood vessel is ingested by the tumor. It is inside the tumor. Now brain looks gray, and these white lines inside brain, they are quarter spaces. They're called as CSF, and it is the architecture is very well preserved on this side. You can see white lines. You can see alternating gray areas. But on this side, there is a big, huge cloud formation. Can you see this cloud?
Yes.
This is called as brain edema. Now this is a temporal lobe. This is temporal lobe, and temporal lobe has swelling which has spread away from the tumor. Now this is the tumor, and the swelling has reached almost twice the distance from the tumor. Tumor का size अगर हम if we think that this is the size of the tumor, this is the anteroposterior diameter of the tumor. So it's like twice that size the edema has spread in the brain. So that means this tumor, though it is a benign tumor, it is not a cancer, but the capacity or the adaptability of brain for that tumor has completely been lost. That's why the brain is producing reaction. So brain is producing reaction in the form of edema or brain swelling. When your brain swells, it causes malfunction of that part of brain, first thing. Second, it can cause seizures. Third, it can cause weakness involving opposite side of the body. Like this is left side of brain which is swollen. So right half of the body can become problematic. And that was first suspicion when I examined her. I could see that her right hand and right leg were a bit spastic. Spastic means it is the neuronal loss which causes some weird stiffness to appear in hands and legs. So that might be the reason why she fell down in first place. Because she fell down all of a sudden. There was no reason why she could have fallen down. So this is the tumor. Now this is a different, this is called as T2 weighted MRI. We are not able to see tumor very clear, but we know that there is a tumor here. I'll go to one level up, like 1 centimeter up, and you can see the real extent of the tumor. Can you see the tumor is pretty big? Here, yeah, because this is up one cut below. It is at the level of eyeball. We are going above the level of eyeball. Now you can't see eyes very well here. You are able to see eyes. Yeah. So here the tumor is pretty big, and you can again see the cloud formation in the brain. This is brain swelling. That is brain reaction, brain edema, which has appeared because of irritation caused by the tumor. Now, why we say that this is not a cancer? Because it is a very well circumscribed tumor. Cancer has tendency to invade. Cancer usually invade brain. Like if this is brain, these are brain cells and these are cancer cells. They invade each other like this. You are not able to differentiate them separately. But here, the tumor structure or tumor architecture is well visualized separate from the brain. So that means it is a benign tumor, and in her case this is meningioma, which arises from the brain coverings. Okay. Now we will go a step above, 1 centimeter above, and there is the tumor which is there, and the edema is almost like 2.5 times. It has gone up to the occipital lobe. Occipital lobe is like where the vision is captured, So when I examined her, that day I forgot to talk to you that day about that finding, that when left half of the brain is edematous or swollen, the vision on the right side is affected. Means both eyes are not able to see well on right side. That is another reason why judgment can go haywire and patient can have a fall. So these are possibilities why a person who is otherwise fit, otherwise walking, physically fit, I'm saying, though she has number of other problems, why she can have a fall, and why she can have a word finding difficulty, that she was not able to fill in the gaps with specific words. She was trying to remember those words. She was struggling to remember those words, but she was not able to speak. So mainly the tumor is problem, but more than tumor, the brain swelling is the problem, which is happening right now in her brain. So we put her on medications to suppress the brain swelling. and she responded it too well. And those are usually steroids. We give steroids to take care of this brain swelling. On the opposite side, you can compare. On right side, the architecture of brain is very well preserved. This is called as ventricle. This is a proper normal water cavity inside the brain. And similar water cavity is seen here also. Can you see this membrane kind of? Okay. But rest of the white thing is brain swelling. It is edema. It is brain reaction. Okay. So this was about the T2 sequence. Now I'll show you a contrast image of her brain, tumor properly. Okay, because this is not a contrast image. I will shut this thing off. Give me a minute. And let me see where is the contrast study. Yeah, this is not contrast. Give me a minute again here. I think this is, yeah. I'm sharing my screen again. Can you see it now? Are you able to see? Yeah. So I will zoom it at a particular portion of the scan. Now you are able to see something like a skull structure. This is neck. This is head. These are eyeball. One of the eyeball is seen because when we take the vertical sections of the brain, you are able to see only one of the eyeball. You can't see both eyeballs together because they are situated away from each other, right? So this is left eyeball. Okay. Yeah. And tumor is below and above it inside the skull. So that is the level because this is the anatomical level. Tumor is above and below it. Yeah. So this is the tumor. Now tumor is very well seen. Can you make out the tumor from the brain? Tumor and brain look totally different. Tumor is very, very bright, very, very bright. This is called as contrast enhanced MRI, where the contrast is a chemical which is injected inside the veins of the patient. It reaches brain and it is taken up by abnormal cells which are present in the brain. So normal brain looks normal. It looks gray. But the abnormal brain part or abnormal tumors or abnormality, any abnormality, infection or anything, it looks very bright or very, very whitish on the contrast. And one peculiar thing, can you make out this tail? This is called as dural tail. So this is actually the cover of brain which has become very thickened and the tumor has arise from the dural cover. This is the cover which runs like this. It covers the brain. It's called as dura mater. So this is a tumor which is coming out of dura mater. It's not actually a brain tumor, though it is compressing the brain and causing problems of brain, but it is a tumor which arises from the coverings of the brain. Okay. Unfortunately, there is no extra space available inside the skull. So to some extent, when tumor grows, brain adjusts its orientation around the tumor. But when that adjustment level is reached, means the maximum adjustability is reached, then tumor starts producing symptoms, and that's how she is symptomatic because of tumor. So we need to reduce this tumor volume. We need to take this tumor out because unless we remove that tumor, the brain swelling won't reduce. Number one. Unless we remove the tumor, this space which has been occupied by the tumor won't get free so that brain can adjust again itself to the original position. And third thing, the natural history. Whenever we want to treat someone, whenever we want to do surgery or anything to any patient, we need to know if we don't treat that patient, what will happen. So naturally, tumor has tendency to grow. This tumor is not amenable to anything like medicines, anything like radiation. It's a big, huge tumor. Had it been a very small tumor, a centimeter or 2 centimeters, then definitely radiation can kill those cells effectively. But when tumor is pretty big, it's like almost 7-8 centimeter tumor. When tumor is pretty big, then radiation is not able to solve that issue. No medicine is available. So there is only one treatment which is left, that is surgery of the tumor. So when we operate, what we do means this tumor arises from the membrane or the covering of the brain. So we try to attack the coverings first because it derives blood supply from the brain cover. So from below up, now you can see the eye. So the blood supply which is going from below up, it is supplying the tumor. So we need to attack the base first and then we need to remove the tumor. Problem with this tumor removal is blood vessels because tumor inside has invaded certain blood vessels. Now I will show you axial cuts if I can see. Now this is the front cut. Now you can see the actual extent of the tumor. This is the vertical, but it is a coronal cut, what we call it as. When a slice is cut in this plane, this slice was cut in this plane, so midline. just like a midline. Okay, it was cut in this line. Now this picture, it is cut in this line like this. So if I take off my face completely and I go behind, I'll be able to see the tumor. Now you see actual extent of it's a pretty big tumor. It's almost involving 1/3 of the skull cavity. Now this is brain which is remaining, and this is a big huge.
Oh shit, was that disconnect?
No, just go on to your main screen. Where is the link?